Welcome to the Maternity Mentor. Today we will be talking about cervical cerclages and how they can prevent preterm birth. Stay with us. Hi, I'm Samantha. I'm a board-certified nurse practitioner, and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Cervical cerclage is a procedure that can be performed to prevent preterm labor. It is successful in 85 to 90% of cases in which it is used. Let's explore what a cerclage is and why you may need one. A cervical cerclage is a surgical procedure performed for the treatment of an incompetent cervix. Incompetent cervix is sometimes also called shortened cervix. This happens when a woman's cervix, which is the opening to the uterus, either opens up, also called dilation, or shortens in length too early in the pregnancy. Without treatment, preterm labor can start and a woman can have a miscarriage. A cerclage is when your physician enters through the vagina and sews the cervix shut. These stitches remain in place either until the 37th to 38th week of pregnancy, when they are removed to allow for a vaginal birth, or if preterm labor occurs prior to this. Cervical cerclage is only used to treat a cervix that is opening prematurely and cannot treat other causes of preterm labor. You are at increased risk of having a weakened cervix if you have a previous history of a cone biopsy or LEEP procedure, you have a history of second trimester miscarriages, you have a history of having a previous cerclage, or you have damage to your cervix caused by an abortion. Typically, a cerclage is performed during the 3rd month of pregnancy at approximately 12 to 14 weeks gestation. Some women may need to have an emergent cerclage placed later in their pregnancy if changes or shortening of the cervix is noted. If this occurs, there is an increased chance that a cerclage will be required for future pregnancies. As with any surgical procedure, there are risks associated with having a cerclage placed. Some of these risks include premature contractions, cervical infection, bleeding, cervical laceration if you go into labor before the cerclage is removed, anesthesia reactions including nausea and vomiting, rupture of membranes or your water breaking, and cervical dystocia. Cervical dystocia is when the cervix cannot dilate normally during labor. This places you at increased risk for having a cesarean section. Also, if the stitch falls out, you are at increased risk for miscarriage and preterm labor. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now, let's talk about who should not receive a cerclage. A cerclage cannot be used for everyone who is at risk for preterm birth. A cervical cerclage should not be used if you are in active preterm labor, you have an intrauterine infection, you have active vaginal bleeding, you have prolapsed fetal membranes, which is when the amniotic sac starts to fall through the cervix. This is also sometimes called bulging membranes. Your water has already broken, which is also called premature rupture of membranes, or if you are pregnant with multiples like twins or triplets. If your baby has an anomaly that is not compatible with life, your provider may not recommend a cerclage due to the potential risks to you from the surgery. The cerclage procedure is usually performed in a hospital that has labor and delivery services. The cerclage will take place in an operating room using anesthesia. You may receive general, spinal, or epidural anesthesia depending on your medical history and your provider's preferences. Your provider will place your legs in stirrups and insert a speculum and other instruments into your vagina to open the vaginal canal up for proper view of the cervix. Then a strong thread or band will be placed around the cervix and tightened to keep it closed. Many women will stay in the hospital only for a few hours after the procedure. Your provider will want to make sure that you are able to urinate and eat prior to discharge. You may feel uncomfortable for the next few days and experience some mild cramping. Light bleeding is also possible, and that will be followed by some vaginal discharge. Many women will receive a prescription for antibiotics to prevent infection, and it's very important that you take all the antibiotics as prescribed. You will need to rest for a few days after the procedure to recover. You then may be able to resume your normal activities. Your healthcare provider may also recommend that you abstain from sex before and after your procedure. Often, this is only for a short period of time, and it's very important to follow the guidelines set forth by your doctor. Following your procedure, it is important to look out for the symptoms that could indicate you are having a complication. These symptoms include lower abdominal pain that comes and goes like contractions, lower back pain that comes and goes like contractions, cramping or known contractions, vaginal bleeding, passing clots of blood, nausea and/or vomiting, fever over 100 degrees Fahrenheit or 37.8 degrees Celsius, chills, difficulty urinating, foul smelling or bad odor from the vagina or vaginal discharge, discharge that is green or yellow, and your water leaking or breaking. If you're experiencing any of these symptoms, contact your healthcare provider immediately or go to the nearest emergency room. Cervical cerclages can be a very effective treatment to prevent preterm birth when you're experiencing preterm cervical dilation. I hope this has explained what a cerclage is and how it may be able to help you. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.